Hello, Sonoma County. This is Dr. Tom. I am on Ask the Expert every Thursday with you. Thank you for tuning in. And today we are lucky enough to have two guests. We have
Brydie Burke.
Brydie Burke. Brydie Burke is our surgical tech, surgical assistant, patient and medical assistant, and is a wonderful part of our team. And so we have Brydie here as our guest, and we also have a guest programmer here. Hey, Dr. Doug.
How you doing, sir? Everything good?
Everything's great. So we have Dr. Doug is filling in for us, and we always appreciate the team here at KSRO helping us out. And how did you come up with the name Dr. Doug?
Well, I needed something catchy, and, I was born and raised here, and Dr. Dawn was a big deal. I'm sure there's a lot of listeners that know Dr. Dawn.
Right.
So I needed a catchy name, but boy, I'm telling you, I'm blessed to be able to be in here with you. I've heard so much about you, and you've been doing this for a long time.
We've been doing it for a long time. Yeah, don't tell anybody that. Okay, I don't like to admit how old I am. But
I got to tell you, you're very good at your job, and you're great on the radio too. So if you want to quit your day job, you're just fine. So.
Well, what I see, I'm envious. We always like what other people do. I've always wanted to be a disc jockey, so I should be like you.
Great.
All right.
Sounds good.
Well, listen, we appreciate it, and it's funny you should say that, Dr. Doug and Dr. Don, because I always thought that Tom is actually really my last name, and that it would be it's kind of a funny thing. And then all of a sudden there's Dr. Phil and all these people, so it kind of fits right in with the new wave of doctors, I guess.
So I apologize when I called you Tom earlier.
Yeah, there you go. No problem. I'm used to that. That's been going on forever.
Okay.
So anyways, thank you all, our listeners at KSRO, Ask the Expert. We really appreciate you. And I had a young lady, a nurse, that was just a patient of mine here, and she always listens to us. So I'm kind of waving to her, not going to mention her name for our HIPAA confidentiality, but we appreciate you coming to see us and listening. So Brydie, welcome to the show.
Thank you for having me again.
Yeah, I love having Brydie. Bridie's been just a wonderful addition to our team. She was a dermatology nurse for 10 or 11 years.
Medical assistant, yes.
Medical assistant for 10 or 11 years, acting like a dermatologist, and with my good friend, Dr. Del Westrom, who retired. And as soon as we found out that he retired, we grabbed Brydie and had her come and join our team. And it's been a huge part of our team over the last 2 to 3 years. So, Brydie, we just recently went on an adventure.
Yes.
What did we do?
Yes, we had a great time. We went to to a wonderful conference in La Quinta, Palm Springs, the American Academy.
Keep on going.
Cosmetic Surgery.
There you go. I'm letting her struggle on purpose here. I'm usually trying to help and help them out here on the show because they're not usually on the show. But yes, we did. Brydie, thank you. You came and joined us. You, along with Jess, our cosmetic laser nurse specialist, and Mary, our lead nurse, and we went to the American Academy of Cosmetic Surgery in La Quinta, California, and it is a national meeting, even though we ended up being close to home, which was really nice. It was a great little flight, a little hour and a half at most to get down there and in the desert. And so we were there, and it's always refreshing to me. It actually fills my bucket. It brings me joy to be able to spend time with my colleagues at the American Academy of Cosmetic Surgery, because having an opportunity to talk to my colleagues and exchange ideas, and that's really wonderful for me, because when we're working in our office a lot of time, our head's buried down in our work, and we're not having that opportunity to learn. And really the fear that I have in terms of offering the best care that I can, being the best that I can for my patients, is my fear is that when we begin to just believe our own press releases. Okay. Right. In other words, the way that I do it's the only way to do it. And after a while, if you're not talking to people, not learning, that can be very dangerous. So it's important for us to exchange ideas, learn from our colleagues. And so for me, it's great. Besides the honor of being invited to present there, I mean and of course that makes my ego feel good that they still want to hear from me. But it is really very wonderful for me from a learning standpoint. For you, coming in as a medical assistant, and was this your first American Academy of Cosmetic Surgery meeting?
No, it was not. I had the pleasure of the second one.
This is your second one. Where do we go for the first one?
New Orleans.
Doesn't Brydie have a rough job? She joins the team and she's off to New Orleans eating beignets and then going down to La Quinta and having great Mexican food down there, right? We had some great dinners there. So tell me, what was it like, this experience for you at the American Academy of Cosmetic Surgery?
Well, first of all, thank you again for inviting me. As your staff, I think it's such an important contribution to the whole team, the whole office, and just learning everything that this industry has to offer and continuing that education. I really enjoyed, as your surgical tech, as well as MA, is learning all about the different surgical procedures. Tummy tucks was one of my interesting ones that I enjoyed. The breast lifts that we do a lot of, and being able to see the different procedures that are out there, and or reiterating that what we're doing is among what's common, and just kind of reiterating what I already know. So learning.
Right, so it's one of the things. It's kind of funny, Brydie, when we listen to other lecturers and what makes us like that lecture. Well, sometimes, and it might even be with who your radio show host is, like with Dr. Doug, is that if you like the speaker, so that's kind of a funny thing, not necessarily scientific, but it's true. If you like the speaker and you're listening to them, what we're doing is we're trying to see, do I like that person? Do I believe them? Do I believe he or she is giving me, the appropriate information? And then what are the new items, or what new knowledge are they imparting upon us? So I think that's part of it. Another part of that, in terms of whether we like a lecture or not, is whether they agree with kind of our philosophy on how to do things, right? Sometimes, as much as we're human and I try to challenge myself to learn new things, I have to protect myself I have to fight that from being like an old guy. And so when something new comes in, not to say, oh, that's not going to work, but is to actually really assess it critically. And that's what's great about going to meetings like that. And for me, what's a little sad is that I used to be the young Turk there, and now I'm kind of the old Turk, And that does happen. Listen, you young Turks out there, it happens way quicker than you realize, all right? So enjoy every moment of it. But going there, and what's really great is I kind of met a few of the younger surgeons, and what's really nice is that I kind of watch their response as well. So as I'm listening something and we're discussing it, and I don't necessarily share my initial thoughts because I want to hear what they say and not alter, their responses, and seeing how they accept maybe a new idea. And then I try to formulate that with my experience and figure out, what is it that we want to bring back to our office. And that's always, that's always a little bit of the tricky thing. So let's talk a little bit about tummy tucks. You said, so that was kind of interesting. What was the hot topic with tummy tucks?
Hot topic right now is the dramatic weight loss that is going on with the new medications, Ozempic. I can never remember the name of the other, but just,
that's okay.
And then of course leaving these patients with a lot of loose skin. So really having to do a whole body lift to help and get rid of that. What's left over. So
that's really kind of the hot thing right now in medicine, and there's good and bad to it. But certainly for patients who are diabetics, or patients whose weight issue is really a medical issue for them and can affect them in terms of their longevity, the new quotes diabetic medications like Ozempic and so forth, that one of the side effects is actually weight loss. And so there are many people who have that disease who are losing weight, but there are also people who just have the disease, and it is a disease, being morbidly obese. They're using this medication. It's making a huge difference in their life, and it's going to improve their longevity. It's a positive medical thing. However, now what happens, and I have a dear friend who actually reached out to me, who always claims that my other life as a general vascular surgeon some 20 plus years ago said that I saved her mother's life. I don't know about that, but she's always has told me that, and she contacted me because she actually weighed over 300 pounds, and she started on had some procedures done, and it can be medications or it can be bypass surgery, and she subsequently has lost a lot of weight and is stabilized over 175 pounds. So now, of course, that's really great for her health, but she has a lot of excess skin. And I think that's what you were referring to, Brydie, is that now you have these patients. So we're having to be more and more aggressive with how much skin has to be removed. And so for those of you who don't suffer from that problem and say, well, what's the big deal? They're healthy and so forth. What's the big deal of them having excess skin? If you could see the photos of these patients, the skin is hanging way down below the groin. We're talking about probably having to grab that skin and pulling it up just to get it into their slacks or their pants, okay, or hanging down. It is very bothersome. So it's not only just a vanity psychological, I want to feel better about myself, but it actually is physically an impairment in their everyday life and their daily activities. So these patients are looking for a cure, and that cure is performing a tummy tuck. So a lot of these patients are coming in for tummy tucks. Now, that is a procedure that we don't do a lot of at our Dr. Tom Cosmetic Surgery Center. And the reason that is not because I don't want to take care of those patients, but the reason is that my niche in surgery is that we do everything under local anesthesia. So that's the key here. So we do everything under local anesthesia. So part of that is making sure that we have the appropriate candidate or patient for that, and making sure that that patient has the appropriate doctor and surgical team like you, who know that it takes more time to do things under local because we're injecting local all along the way, but that it can be safer. Okay, absolutely can be safer, quicker recovery, and less downtime. The problem is, and it's the yin and the yang of everything in life, is that I love local anesthesia. You know, I mean, what kind of procedures do we do under local anesthesia, Brydie?
Oh, we do SmartLipo,
Okay.
breast lifts, breast augs. We do fat grafting to the face.
Right.
Tummy tucks.
Tummy tucks.
Yep.
And eyelid surgery, right?
And
eyelid
upper
surgery.
eyelid, yes.
So we do
Fascinating.
a lot of operations all under local anesthesia. But again, the yin and the yang. I tell people that you can take a couple of aspirin, but you can't take the whole bottle at one time. So again, making sure that we do procedures safely for patients, we are limited to how much local anesthesia we can use. So for these massive weight loss patients who have that much excess skin, we're not an appropriate center for them. Our technique isn't, unfortunately, a good fit for those patients. So if you were to have those problems and you were to end up seeing us at the office, we don't abandon you. We talk to you, get some more information, try to give you some guidance, and then we would refer you on to the centers that would be able to perform those procedures. And actually, that's what my dear friend who wants me to do her operation is struggling with. She's thinking about maybe having part of it done and then coming to see us. If she can get it done all at one spot, that's what I would encourage her to do. But so we look at the different nuances. So part of that is we ask our patients before their consultation actually send in photos. The reason that we want them to do that is so that you and I can study them, and Karina, our other surgical liaison, and we can study those photos, and then we can kind of get a game plan. We can also see a lot of times from the photos, hey, Jill is a perfect candidate for us. Or we might look at it and say, oh, Ron has way too much skin for us to do. And so we don't want to waste their time. We will contact them and let them know that we may not be the right fit for them, and we would refer them on to a center where they do more massive weight loss surgery. So, but you're right. That is absolutely one of the hot topics that has been going on in cosmetic surgery. What else was discussed quite a bit during that time?
A lot of doctors came on and talked about their breast lifts and a couple different techniques that I had never seen, but also nice to see the technique that we do. Oh yeah, that's why we do these things and the different steps.
So you're talking about when I presented my...
Yes.
Right. Okay.
Yes, Dr. Tom had a wonderful talk about how he does.
That's what I was leading into. About time you said that. I don't know why you didn't say that initially, but okay. No. All right.
One of my favorite speeches.
Okay.
So yeah, talking about how we do our breast lifts in our office.
Right. So I was really honored and really pleased to be able to present once again at the American Academy of Cosmetic Surgery meeting. It's a great venue where it's really education without borders. You know, I'd like to think the doctors are really just super about everything, but sometimes they can be proprietary about their knowledge. The world has become a little bit, I hate to say that, a little bit negative that way. And so this organization is really great because we actually encourage people to talk to each other. We actually open up our offices for other doctors to come. And in fact, what's really great is I'm going to actually go down and visit Suzanne Obagi, Dr. Obagi of the Obagi, who is the medical director of the Obagi skincare line. And I'm going to go there specifically to learn her techniques on chemical peels. And that's really great. I'm going to be flying to Pittsburgh sometime. She wants me to come in the summer. Says the weather's better in the summer. Okay. Not when it's cold in Pittsburgh. Being from Michigan, I know that. I
Yeah.
wouldn't go back in the middle of winter either. So that's what's really great. So having said all of that, I presented my procedure, and it's interesting that I heard back from Mary, our lead nurse, that Brydie was saying, "Hey, oh, now I get that. I see that's why we're doing that. So sometimes when you're right in the middle of procedures, you think we're doing it by rote, but we're really doing each step along the way for a specific purpose."
Correct.
Yeah.
Yeah. It's,
And so the concept that I was talking about, actually, my lecture was about patients who have severe, we call it ptosis, Ptosis. It's a weird medical term, but it means droop. Okay, so droopy breast. And, I know there are a lot of bad jokes and everything about that. But again, like excess skin in the abdomen for patients who have massive weight loss, you don't know what it's like for these ladies who the breast is hanging down over their rib cage, maybe down to their belly button. And although it sounds like, if it's not your problem, it could be something to make a joke about, it's not a joke. These patients, it really affects their self-confidence. It keeps women from disrobing in front of their loved ones or their significant others. And it's very difficult to find clothes to wear. And these patients are some of the most grateful patients that we have. Think about the patients that
the
we've taken care of.
transformations are incredible.
Yeah, they really are. And thank you for saying that, Brydie. So basically, without getting into too much detail, because this isn't a show for the doctors, it's really for all of you out there in KSRO land for Ask the Expert. But basically, we talk about areas of tissue or attachments that we release, why we release them, because a lot of times what happens is that women who have the severe droopiness of the breast, when they lay down, when they're supine or laying down, the breasts hang off underneath their arms. They feel like it drops down under their armpit. So we release the tissue on that side so that we can bring the breast more to the midline, which is where they want it. Also, on the part that's kind of holding the breast as it's drooping down, I did have one patient who, she's a little jokester. She said her nipples were racing to her belly button, okay? And she was just sort of making fun of something that was causing her a lot of pain in terms of emotional pain. But by releasing those attachments below helps us to lift the tissues up. And so, you've been amazing help with that. You and Karina are amazing surgical assistants for me. And those are the techniques that we do. And I have to say that where we don't do the large volume tummy tucks with a lot of excess skin, in terms of droopiness of the breast, we're able to very nicely perform all of that under local anesthesia. And that's really a great technique for us. So that was a lot of fun. And in fact, one of my colleagues who's down from Southern California, and he actually just texted me yesterday, and we had talked about his technique, and he showed me one of them, and he had heard me give the similar talk at the California Academy of Cosmetic Surgery. And again, now we were at the national meeting, and I told him about maybe trying to shorten a distance on one thing, and he sent me a photo. He just did that on one of his patients, and he was really happy with that result. So that made me feel good that I could help one of my colleagues to do a better job, just like I listened to my doctor friends who I admire a lot, and I learned from them. So
that's the reason we go.
That's the reason we go. Okay, so we also had some fun things that were going on. What else was fun about going there?
Well, oh gosh, let's name the list. Got to meet a couple of industry celebrities. Dr. Tom had mentioned Dr. Susan Abaji,
right?
Which was watching her, listening to her speak as well.
Right.
So knowledgeable in her field. Dr. Pimple Popper, just to drop a name. She was our keynote. Dr.
Pimple Popper, right?
Our keynote guest speaker.
Right.
So just seeing her journey and seeing where she started and how it got to her where she is today was pretty interesting and nice. She's okay.
Yeah. Yeah. So Dr. Pimple Popper, that was interesting. When I saw that, I thought, oh, another celebrity doctor, right? So I've been going to these meetings now. This was the 41st annual meeting of the AACS, American Academy of Cosmetic Surgery meeting. And I've heard a couple of, I'm not going to say who they were, a couple of celebrity doctors on TV, national shows. And I have to say that I may just be too old school for this, Brydie, but I kind of listen to them and I'm thinking, it's more about them, and I'm not really hearing, as much about the patients and the passion of medicine. And I have to say that I was pleasantly surprised and super impressed with Dr. Lee. L.E. is her
Sandra
last
Lee,
name,
yes.
Sandra Lee, who was Dr. Pimple Popper. So tell me a little bit about the story. I'm not watching the reality shows much. Do you see her very often?
I started watching when I was in the dermatology world,
Right.
because that's what I did,
Right.
and just her technique, and then of course broadcasting
Mhm.
it was,
Right.
and then getting her own show.
Right.
So just the different. What the main thing was is how she helped these patients.
Right.
You know, it is what it is. Some people find it gross, some people find it fascinating, but to these patients, it was medical. It was something that needed to be taken care of, and she did it with such class and grace,
Right.
and to have her come and express that.
Right.
So,
So Dr. Pimple Popper, we'll just talk about her a little bit. She doesn't even know we're talking about her on this show, but I grew up with a dermatologist father, and she comes from an Asian family background, and she went on to do some training and then did some additional training in cosmetic surgery as well. And so she was, because she's young, okay, and they're, when you're younger than me, everybody seems to be videotaping everything, right, and posting it on, YouTube, TikTok, and everything. And so she was just videotaping a dermatologic procedure.
mhm.
And then she kind of noticed that there was some impaction of probably
A lot of
a
interest.
lot of sebaceous gland just on the side of the nose. So she took a little extractor and pushed on it, and you could kind of see the stuff come up. I mean, we've all been kids and had a Papa-Zit or something like that. And she posted it, and it went viral, right? And just one thing led to another, and the next thing you know, she's on TikTok. She's got her own show, and she says there's a lot of pressure with it because she's got to constantly produce new material for that. But it was just very interesting. What I was most impressed with was, however, was her passion still for helping the patient, and her humility. She was very humble, and I was very impressed with her. So not that she needs any endorsement, but I would say that watching her would be probably a positive thing in terms of learning a little bit about medicine and not being so much just all Hollywood. So that was
For
great.
sure.
So you got to meet some of them. How about in terms of non-surgical? So we talked about tummy tucks, and the big thing is the move for massive weight loss patients, a lot of excess. We talked about what we can offer those patients. And again, if you're interested, you can send in a photo if you're not sure you're a candidate for us, because we do things under local anesthesia, and that's our limiting factor. And so sometimes we will take on patients and get excellent results with our tummy tuck, but sometimes what you have as a patient is not the right fit for our technique. Okay. We talked about breast lifts. That's a very, very common procedure that's going on, popular procedure, I should say, that's going on. And that's something that we offer at the Dr. Tom Cosmetic Surgery. And we are really, actually very excited to see our patients for that, because we can get some great results with the technique under local anesthesia. So besides the medical, is there anything in the non-medical world when we went to this meeting that was a particular interest for you?
Yeah, it's interesting that still the most popular, I guess, thing today is the biostimulant. Saying that right?
Yep.
The different procedures that can be done, like filler injectables that are more using your own body's PRF, and we could probably explain it a little bit better.
Okay.
But that's just seems to be what patients are interested in right now,
Right.
or growing interest in.
Right. So there's a trend, and so social media can be great, but it also, in my opinion, can be negative in terms of, they're again, the whole thing is trends, right? And so there's been a little bit of a trend saying, fillers are bad. So fillers are hyaluronic acids, hyaluronic gels, and that would be Restylane, Juvederm, and so forth. And I'm just going to give you my opinion. My opinion is that fillers are not bad. The inappropriate use of fillers are bad. Using too much, overfilling faces, yes, that's bad. But if you go and talk to your doctor or nurse injector or physician assistant injector, and you tell them what you want, and for now the move is more towards a natural look, which I love that. We use less. We need to be more astute in terms of the areas that we injected. Fillers can be great, but absolutely, as you said, we're on the move towards biostimulatories. Okay. So what type biostimulatories basically are injectables that we use either part of our own body, or we use manufactured products that will stimulate our own biology to produce more tissue, okay, and to get a better cosmetic result and hopefully a more natural look. And so that's what we're looking at. So what kind of biostimulatory treatments were of interest to you when you were listening to the lectures?
So the brand name, Easy
Sure.
Gel.
Okay.
Easy Gel is one that we use.
Okay.
Sculptra.
Okay.
That was a lot out there, which the transformation I've seen with our patients with that has been tremendous.
Okay.
And Renuva.
And Renuva. Okay, and Renuva. Okay, so we'll talk about those. We've got about 5 minutes left, and so we're going to kind of cover all of those. Okay, so let's talk about Easy PRF gel. So E, if you want to look that up, is the letter E. Okay, and Z as in zebra, and then PRF gel. What is that? So you just actually did a procedure with an Easy PRF gel procedure with Mary today, right? This morning.
Right. Yeah.
Okay, I love it. So what we're trying to do is we're trying to draw blood off, and we're trying to pull out the active, I'm going to call it repairing component of our blood serum, and that's platelet-rich plasma, PRP, and that is beneficial. But what we want to do is we want to activate it. We want to kind of get that PRP on steroids. So we actually want to activate that platelet-rich plasma into platelet-rich fibrin, okay, which even has more reparative properties than PRP. All right. So tell me a little bit about the process of performing Easy PRF gel procedures.
So once we've taken the sample, blood sample, we draw your blood into 2 different tubes. We do kind of, as Dr. Tom likes to express, Karina and myself, the other medical assistant, go into our back room. We have a couple different machines where we process.
They're mad scientists. That's what I call them.
We have to cool, we have to heat, we have to spin in different velocity, I guess is the word.
Okay, so so they're centrifuging down the two syringes.
Yes.
Okay, that you just drew off the patient in a typical blood lab draw, and so one of them you're cooling down, correct?
Correct.
Okay, and so that's the PRF, and so we want to have the platelet-rich fibrin, which is going to be the active component, but we don't want it to be too active. Okay, we want to kind of keep it quiet for a few minutes. Okay. And so you're warming up the other syringe, and what is that?
The albumin.
That is the albumin. Okay, so that's the protein. So we're now drawing off the protein out of the other syringe, and we're mixing that PRF with the protein component, and that's the Easy PRF gel. And then we're injecting that, and a very common area to inject that is right under the eyes or the hollow of the eyes, and that's where patients tend to be hollowed and looking older, more tired. And so injecting that area is a great way of rejuvenating that volume in that area with your own body. So that's Easy PRF gel. I know we have just a little bit under 2 minutes left here. So we're going to move on to Sculptra, which also is a powder, which we mix with sterile water, and we can inject throughout the face, and it adds sort of this subtle improvement of volume in the face. And I love, even though I said subtle, the fact that you said that it was transformative.
Yes,
right?
that
you've seen. And I think it's a great treatment, and it's a treatment that you can start at a very early age, in your 30s, in my opinion. You can start on Sculptra, and it can turn back or slow down the hands of time. And I do think that that's a great treatment. If you have more questions about that, please let us know. And then lastly, the number one treatment in terms of probably the most stimulating is fat. Okay, because in our own fat, we have stem cells, all right? And so I do a lot of fat grafting, and, you know, we just did that recently where we take fat from one part of the body and we put it in the face. And that fat not only restores just your natural volume, but it stimulates our own stem cells to form more fat. And so putting it in the appropriate area can rejuvenate the face, make the skin healthier, look better, and that's great. But sometimes we get people like you who are so slender, you have no fat. Okay, I know you say you have fat. You have no fat, Brydie. And so what do? Because you don't have any fat. So we have tissue bank fat, and that's what Renuva is. So we take that tissue bank fat, and we can use that and inject it in different areas, and it stimulates your own stem cells to create your own fat cells and replace the tissue bank fat, which is slowly moved away. Okay, by the body. So that's a great summary. So thank you. So for the American Academy of Cosmetic Surgery meeting, it was great. I was honored to present there, both on biostimulatories, by the way, as well as breast lifts. The technique is super in terms of doing tummy tucks for massive weight loss. That is very popular right now. And breast lifts is still a real significant demand for patients because of the significant discomfort and lack of confidence that it produces. So we want to thank all of you here listening to us on KSRO. Tune in next week and we'll have some more fun things to talk about in the world of cosmetic surgery.
Thank you.